So let's get into what is manual therapy and
Mhm.
why, with somebody who has that much trauma in their body. I mean, a lot of us don't really know it, but how can manual therapy help with that?
So the manual therapy that I do, and just to kind of give a definition of manual therapy, is kind of using your hands, or sometimes they use tools to work on the tissues of the body or the different organs of the body. Um, so I kind of call myself a manual therapist because I'm not actually a licensed physical therapist, but I do have my massage license, but I don't do like your traditional massage, right? Like the oils and doing all that. So a lot of the manual therapy techniques that I've learned, I'm in the same classes as chiropractors, physical therapists, osteopathic physicians, all those people. So I'm learning alongside them. And the techniques that I've found to be the most effective through those certifications have been something called fascial counterstrain. And what we do is we actually treat the fascia that is surrounds all of the different structures of the body. So the nerves, the arteries, the veins, the bones, the organs, even into the brain. And so what we do is we kind of um, go into the structure and ease the tension. And so, to give an example, if you've got like your zipper and your jacket and you're trying to zip it all the way up and it gets stuck, right? Traditional manual therapy that is more of what we call a direct technique would be to kind of just force that zipper through and just kind of get it to go all the way up. With this type of manual therapy, what we do is we actually bring that zipper down, allow the stuff to get out the way, and then we can zip it up. And so what
Mm,
we do is instead of going to like a tight muscle, for example, we don't go in and kind of dig into it and try to like mash the tissue into submission. What we do is we actually shorten the muscle. And what that does is it allows the body to sense that it's safe, and then it'll relax. And so, what I found with that, and some of the higher level practitioners actually work with PTSD,
mm,
post traumatic stress syndrome. What they do is they actually work on the nerves that go into like the adrenals, the ones that kind of help you produce adrenaline and cortisol, because those are very heightened in people that have PTSD. And so what we do is we treat the nerves that go in there to relax it so that it's not upregulating or making it more stimulating. And then what they do is after they get treated, then they go and do talk therapy.